Welcome to my YouTube channel. I am going to upload the whole syllabus of anatomy including upper limb, lower limb, thorax, abdomen, pelvis as well as CNS. So we have already started with the lower limb session. Our today's topic is obturator nerve. So we will be learning this topic in 4 subheadings, that is introduction, its origin and root value, course and relation and the clinical anatomy. So let's start with the introduction. Obturator nerve, it is the chief nerve of the medial compartment of the thigh. So it is a chief nerve of medial compartment of thigh. Origin and root value, it is a branch of lumbar plexus. It is formed by ventral division of anterior primary rami of spinal nerves L2, L3 and L4. So the dorsal division of anterior primary rami, which was formed by femoral nerve. The ventral division is formed by obturator nerve. So remember this. Proximal part lies in the pelvis, then it enters the thigh via the obturator canal. So it is a branch of the lumbar plexus formed by the ventral division. It lies in the pelvis and then enters the thigh through the obturator canal. Course and relation. Within the obturator canal, it divides into anterior and the posterior division. Anterior division, it is downwards in front of obturator externus muscle, separated from the posterior division. Behind it travels behind the pectineus and adductor longus muscle, front of adductor brevis. It gives branch to the hip joint. Below the lower border of adductor longus, supply the tweak to subsartorial plexus and end by supplying the femoral artery. It supplies pectineus, adductor longus, gracilis and adductor brevis if it is not supplied by the posterior division. So as we can see, it travels in front of the adductor brevis muscle, behind the pectineus and adductor longus. It also gives an articular tweak to hip joint. It supplies pectineus muscle, adductor longus muscle, gracilis muscle and the adductor brevis if it is not supplied by the posterior division. Posterior division, it enters by piercing the upper border of the obturator externus muscle. It travels behind the obturator adductor brevis, front of the adductor magnus, and it is in the adductor canal. It is reduced to the thin genicular branch which enters the popliteal fossa, piercing the oblique popliteal ligament and end by supplying the capsule and the cruciate ligament of the knee joint. It supplies obturator externus, adductor magnus and adductor brevis if it is not supplied by the anterior division. So the posterior division pierces the upper border of obturator externus muscle. Obturator externus muscle के upper border को pierce करेगा. फिर जाता है front of the adductor magnus के and behind the adductor brevis. As we can see, this nerve is traveling behind the adductor brevis and in front of the adductor magnus muscle. Then it is reduced within the genicular branch which enters the popliteal fossa in the adductor canal and which pairs the oblique popliteal ligament. Then it is end by supplying the capsule and the cruciate ligament of the knee joint. It supplies obturator externus, adductor magnus and adductor brevis if not supplied by the anterior division. Clinical anatomy. Disease of hip joint may cause referred pain in the knee and medial side of thigh because they are common nerve supply by the obturator nerve. So any disease of the hip joint can cause the referred pain in the knee and medial side of thigh because both are supplied by the obturator nerve. An obturator nerve may be involved with the femoral nerve in retroperitoneal tumors. The tumors behind the peritoneum, it's called as retroperitoneal tumors. It may be involved in the obturator nerve along with the femoral nerve. So I hope you all have understood this topic. If there is any query, so please do comment in the comment section. And if you want such more videos, then please subscribe my channel and follow me. Thank you so much.